This is Professor Capron, and today we're learning about respiration. The information for this comes from your ATI Fundamentals of Nursing textbook, Chapter 27, and your Taylor's Fundamentals of Nursing textbook, Chapter 26. Let's take a minute to explore the anatomy of the respiratory system. This system is essential for breathing, which is a process vital for life. So let's break down its components and functions in an easy to understand manner. The respiratory system is a complex network that facilitates breathing. Breathing involves inhaling oxygen and exhaling carbon dioxide, which is a waste product of our body's metabolism. Think of the respiratory system as a tree. The airways, including the nose, throat, and bronchi, are like branches that transport air to and from the lungs, which are like the roots where the exchange of gases happen. Air enters the respiratory system through the nose or mouth. The nose, with its hairs and mucous membranes, filters, moistens, and warms the air, preparing it for the lungs. The trachea or windpipe is like a main stem that divides into smaller branches called bronchi. These bronchi then divide further into smaller branches in the lungs called bronchioles. The lungs are two sponge-like organs in the chest. Inside the lungs, the bronchioles end in tiny air sacs called alveoli. This is where the magic happens, the exchange of oxygen and carbon dioxide. The primary function of the respiratory system is gas exchange. Oxygen from the air we breathe is absorbed into the bloodstream through the alveoli. At the same time, carbon dioxide, a waste product of metabolism, is transferred from the blood to the alveoli to be exhaled. This exchange is crucial because oxygen is needed by every cell in the body to produce energy, and carbon dioxide, being a waste product, needs to be removed efficiently to maintain a healthy internal environment. So, the respiratory system, the airways and lungs, is essential for delivering oxygen to our body and removing carbon dioxide. Understanding its anatomy helps us to grasp how breathing supports life. Now let's look at how our respiratory system is regulated. This regulation is crucial for ensuring that our body's needs for oxygen and carbon dioxide exchange are met. The respiratory system is finely tuned by both neurological and chemical mechanisms. This dual regulation ensures that our breathing adapts to the body's varying demands. The brain, particularly the brainstem, plays a key role in controlling the rate and depth of breathing. It sends nerve signals to the muscles involved in breathing, like the diaphragm and intercostal muscles, to initiate each breath. This is when the chemoreceptors come into play. Chemoreceptors are special sensory receptors that are sensitive to chemical changes in the blood, particularly carbon dioxide and oxygen levels. Chemoreceptors that are located in the carotid arteries near the neck and the aorta, the main artery leaving the heart, constantly monitor the blood CO2 levels. When CO2 levels rise, which can happen during physical activity or even when holding your breath, these chemoreceptors detect the change and send signals to the brain's respiratory center. The brain then responds by increasing the respiratory rate. This means you breathe faster and deeper, helping to rid the body of excess CO2 and bring in more oxygen. In conditions like chronic obstructive pulmonary disease, COPD, where breathing becomes difficult, the regulation of respiration can change. Normally, high CO2 levels are the primary driver for increasing breathing rate. However, in COPD patients, their bodies adapt to chronically high CO2 levels. Here, low oxygen levels, hypoxia, becomes the main stimulus for breathing. This shift is significant because it changes how we treat and support patients with COPD, especially in managing their oxygen therapy. We need to allow their oxygen levels to become a little bit lower in order for them to have a reason to breathe. Understand that the regulation of respiration is a very complicated interplay between neurological controls and chemical sensors in our body, and all of these mechanisms ensure that our breathing meets the body's needs, adjusting for changes in activity levels or health conditions like COPD. Now let's look at respiratory rate. This is an essential vital sign in assessing a patient's respiratory health. Respiratory rate is the count of how many breaths a person takes per minute. When we breathe, air moves in and out of our lungs, and each cycle of breathing in, which is called inhalation, and breathing out, which is called exhalation, counts as one breath. For adults, the normal resting respiratory rate typically ranges from 12 to 20 breaths per minute. However, this rate can vary depending on factors like age, fitness level, and overall health. A comprehensive respiratory assessment involves observing three key aspects: rate, depth, and rhythm of breathing. Rate is determined by counting the number of times the chest rises and falls in 1 minute. It's a straightforward count, but accuracy is crucial. If the rate is too fast or too slow compared to the normal range, it may indicate either respiratory or systemic problems. Depth refers to the amount of chest wall expansion with each breath. Observing the depth helps us to understand how much air is being inhaled and exhaled. Depth can be described as shallow, normal, or deep. Shallow breathing may indicate conditions like pain or rib fracture, while deep breathing might be seen in cases of metabolic acidosis. Rhythm is about the pattern of breathing. It should be regular and consistent. Irregularities in rhythm, like periods of apnea, which means no breathing, or Shane-Stokes respirations, which is a pattern of increasing and then decreasing depth followed by a period of apnea, can signal neurological issues or other severe health problems. To measure, watch the patient's chest rise and fall. Each rise and fall counts as one breath. Count for 30 seconds and multiply by 2 if there is a regular rhythm to the breathing. Count for a full minute if the rhythm seems irregular or if you suspect any abnormalities. It's important to perform this assessment without the patient being aware, as people can alter their breathing pattern if they know they're being observed. So often, a nurse will tell a patient they're taking their pulse, and they will continue holding their pulse while observing their respiratory rate after they have finished counting their pulse. So, measuring the respiratory rate along with observing the depth and rhythm of breathing is a fundamental nursing skill that provides critical information about a patient's respiratory function and overall health status. Now let's explore the various factors that can affect respiration. Respiratory rates change significantly with age. Newborns and infants breathe much faster than older children and adults. This is because they have smaller lungs and higher metabolic rates, requiring more breaths to meet their oxygen needs. As children grow, their lung capacity increases and their breathing rate gradually decreases. By adulthood, the normal respiratory rate stabilizes between 12 to 20 breaths per minute. In older adults, respiratory function may decline due to factors like decreased lung elasticity and muscle strength, potentially leading to slower and shallower breathing. Men and children are often diaphragmatic breathers, meaning they primarily use their diaphragm for breathing. This results in more noticeable abdominal movement during breathing. Women, on the other hand, tend to use more thoracic muscles located in the chest. This difference causes more pronounced chest movements during breathing. These gender specific breathing patterns are due to anatomical and physiological differences, including muscle development and distribution. The position of the body can significantly influence breathing. Upright positions, such as standing or sitting, allow for more full chest expansion, facilitating easier and deeper breathing. In contrast, lying down can restrict chest expansion, especially if a person is lying on their back or is obese, which can compress the chest and abdomen. This is why patients with respiratory difficulties are often placed in positions that optimize chest expansion, such as a semi-Fowler's or even more upright position. Other factors that influence respiration include things like pain. Chest or abdominal pain can lead to shallow, guarded breathing to minimize discomfort. Anxiety increases both the rate and depth of respirations. Chronic smoking can lead to an increased resting respiratory rate and decreased lung function. Certain medications, like opioids and sedatives, can depress respiratory function, while stimulants can increase it. Injuries to the brainstem can disrupt the normal respiratory rate and rhythm. And conditions that affect the lungs or airways can alter breathing patterns, often leading to increased respiratory effort and use of accessory muscles. Now let's look at pulse oximetry. This is an essential tool in respiratory assessment. It's non-invasive and gives us vital information about a patient's oxygen levels. Pulse oximetry is a simple, non-invasive procedure used to measure the oxygen saturation level, or SaO2, in the blood. It tells us how much oxygen the blood is carrying as a percentage of the maximum it could carry. This measurement is important because every cell in our body needs oxygen to function properly. Oxygen saturation indicates how effectively the respiratory system is supplying oxygen to the blood. A pulse oximeter is a small device that clips onto a finger, a toe, an earlobe. It uses light to measure how much oxygen is in the blood. The device emits light that passes through the blood in the small vessels known as capillaries. By measuring how this light is absorbed by oxygenated and deoxygenated blood, the oximeter then calculates the percentage of oxygen in the blood. The normal range for oxygen saturation in a healthy adult is typically between 95% and 100%. This range indicates that most of the hemoglobin, the protein in red blood cells that carries oxygen, is filled with oxygen. However, individuals with chronic lung diseases, such as COPD or asthma, may have lower acceptable levels. This is because their lungs are not able to move oxygen into the blood as efficiently. Pulse oximetry provides a quick, real-time snapshot of a patient's respiratory function. It's particularly useful in emergency situations or for continuous monitoring in critical care. By detecting low oxygen levels early, it allows for timely intervention, which can be crucial in preventing respiratory failure or other serious complications. It's also commonly used to monitor patients during procedures that could affect breathing, as well as managing chronic respiratory conditions. Now let's discuss some altered respiratory patterns and what their significance is. Recognizing these deviations is crucial for early detection of respiratory complications and to initiate appropriate interventions. The first one we're going to look at is called bradypnea. Bradypnea is a reduced respiratory rate, typically under 12 breaths per minute in adults. It can be caused by opioid use, brain injury, metabolic disorders, or sleep-induced respiratory depression. It may indicate hypoventilation, leading to increased blood carbon dioxide levels. Prolonged bradypnea can result in respiratory muscle fatigue, inadequate gas exchange, and potential respiratory arrest. Next, we have tachypnea, and this is an increased respiratory rate, generally over 20 breaths per minute in an adult. Causes include fever, metabolic acidosis, pain, hypoxemia, which is low blood oxygen, and psychological stress. It often signals underlying conditions like pneumonia, pulmonary embolism, or anxiety disorders requiring prompt medical attention. We also have what's called hypoventilation. Hypoventilation refers to insufficient air movement into the lungs, leading to hypercapnia. It can result from neuromuscular disorders, chest wall abnormalities, or sedative overdose. It causes an imbalance in blood gas levels, potentially leading to respiratory acidosis and organ dysfunction. Then we have hyperventilation. This is characterized by rapid and deep breathing. Hyperventilation reduces blood CO2 levels and may be triggered by conditions like panic attacks, lung diseases, or severe infections. Extended hyperventilation can lead to respiratory alkalosis, causing symptoms like dizziness, tingling in the extremities, and sometimes even a loss of consciousness. Apnea is the absence of breathing. Causes range from obstructive sleep apnea to brainstem injury and drug overdose. Apnea disrupts normal respiratory function and oxygenation, potentially leading to critical situations like respiratory arrest. Cheyne-Stokes respirations are an irregular pattern that involves cycles of increasing and decreasing breaths followed by periods of apnea. It's seen in patients with heart failure, stroke, or brain injuries. It indicates severe neurological impairment or end-stage heart failure and requires careful monitoring and management. Kussmaul breathing is characterized by deep, labored breathing, often associated with metabolic acidosis, particularly diabetic ketoacidosis. This pattern signifies the body's attempt to compensate for acidosis by expelling more CO2 through deep, rapid breathing. Understanding these respiratory patterns and their underlying causes can help you to make informed clinical decisions. Early recognition and appropriate response can significantly impact patient outcomes during respiratory complications. Now, I'd like to look a little bit more closely at the differences between hyperventilation and Kussmaul respirations because this can hang some people up sometimes. Remember, hyperventilation is characterized by rapid and deep breathing. The key feature here is the rate and depth of breaths, which are significantly higher than normal. It's often caused by anxiety, panic disorders, or stress. It can also be triggered by physiological conditions such as pain, fever, or certain medications. Other causes can be respiratory conditions like an infection or a pulmonary embolism, where the body's trying to increase oxygen levels or decrease carbon dioxide levels. Hyperventilation leads to a decrease in blood carbon dioxide levels, which is called hypocapnia. And this can cause symptoms like lightheadedness, dizziness, tingling in the hands and feet, and sometimes even fainting. The body's response to stress, psychological, or sometimes physiological factors trigger this condition. In a clinical setting, hyperventilation is most often seen in patients experiencing panic attacks or severe anxiety, although it is also observed in acute pain situations or again in response to those specific medical conditions that affect breathing. Kussmaul respirations are also rapid and deep breaths, but they are particularly marked by their deep, labored, and gasping quality. The breaths in Kussmaul respiration are much more mechanically forced and profound. This breathing pattern is most associated with metabolic acidosis, particularly diabetic ketoacidosis or DKA. It's the body's attempt to correct the acid-base imbalance by expelling more carbon dioxide. The deep breathing is a compensatory mechanism to decrease the acidity of the blood by increasing the release of carbon dioxide. Kussmaul respiration leads to an increase in blood pH by reducing carbon dioxide, which is in response to an underlying acidotic state. Unlike hyperventilation, it's typically not triggered by psychological factors, but instead by a biochemical imbalance in the body. In clinical practice, Kussmaul respiration is often a sign of severe metabolic distress, most notably in patients with uncontrolled diabetes leading to DKA. It's a critical indicator that requires immediate medical attention. Remember, hyperventilation is often triggered by biological factors, while Kussmaul respiration is a compensatory response to metabolic acidosis. Kussmaul respirations are more labored and deeper compared to the rapid but less forced nature of hyperventilation. And hyperventilation can be associated with anxiety or respiratory conditions, whereas Kussmaul respiration is primarily linked to the severe metabolic conditions like DKA.